In today's episode of From the Archives, we'll be taking a look at the origins of March of Dimes' entrance into the world of health equity, starting way back in 1943. March of Dimes began its support of the Tuskegee Institute with a grant of $1.6 million for the construction of a 36-bed infantile paralysis center. It became the first ever after-polio care center for Black people with polio, opening February 9th, 1940. With this grant, March of Dimes began its support for Black Americans with polio in order to honor its pledge that March of Dimes-sponsored care would be given without regard to race, creed, color, or religion. March of Dimes President Basil O'Connor then hired Black civil rights leader Charles Bynum in 1943 to become the foundation's director of interracial activities to maintain outreach to Black Americans. At the time, Mr. Bynum had been a biology teacher and assistant to Tuskegee Institute President Frederick Patterson. Bynum's outreach to Black Americans helped ensure that Black children and adults received proper medical care in polio epidemics. His work consisted of ensuring Black people were aware of the March of Dimes mission, recruiting Black professional organizations to help advance our mission, and ensuring that March of Dimes sponsored polio care was applied equally and fairly. In his work for March of Dimes, Charles Bynum traveled widely throughout the United States to facilitate the service program of patient care at the local level for Black people suffering from polio, and to organize fundraising efforts for rehabilitation and epidemic relief. He promoted the use of Black poster children. Charles Bynum insisted that his outreach would be more effective if Black children participated as poster children in the March of Dimes posters. So, in 1947, March of Dimes selected Rita Reed from Blue Island, Illinois, to be the first Black poster child. In the 1950s, Mr. Bynum conducted an annual fundraising meeting at the Tuskegee Institute for Black professionals and civic leaders. Tuskegee was an obvious venue for the annual campaign, as March of Dimes had supported the Institute in many ways, the initial grant to build the Polio Institute being the first. Joining me today is Rahni Jenkins, Vice President of Mission Operations, and Rahni happens to be one of my favorite people at March of Dimes. Her implicit bias training is amazing, and I recommend you take the course if you haven't already. Recently, Rahni spoke on behalf of March of Dimes at the Tuskegee Polio Recognition Monument unveiling ceremony. So, hello and welcome, Rahni. How are you?
Hello, I'm doing great.
Today's episode of From the Archives is talking about March of Dimes and health equity. Health equity seems to be one of those Johnny-come-lately terms that we see in the world today, but it's really ingrained in March of Dimes' DNA, going back to 1943 when our first president, Basil O'Connor, hired Charles Bynum to be the director of interracial activities at March of Dimes. If I could stress, or I can't stress enough, that ensuring that Black children and Black adults had equal and fair access to polio care, or including Black children in the field trials during the 1950s, that was a big thing for an organization to do during that time, right?
Huge thing, very huge, especially when, breaking the barriers of what segregation looks like, what integration looks like. It was very, very pivotal.
Yeah, a bold stance for an organization that was asking for money from the country and then saying, you're going to have to be okay with us using that money for these activities, which, yeah, probably rubbed people the wrong way at a time, but was needed. Like polio during the 1930s, the 1940s, 1950s was destroying our children and adults. It was ravaging the country. So people just kind of had to be okay with that. And like we needed to find a cure or something to stop polio.
Right.
Recently, you went to go visit the Tuskegee Institute. How did that come about? What was that experience like?
Yeah. So, I want to just give a shout out to our Alabama market, because that's really how it came about. Just engaging that conversation, looking for someone to provide that national representation as well on this very monumental event. When we're talking about getting to the roots of March of Dimes. And so I jumped at the opportunity because, it's just, there's so many different key important components that are attached to that location, right? So when we're looking at not only our sponsoring of the Center for Polio, but then also what you were just mentioning as far as societal changes and adaptations that were being made and barriers being broken within that community, it was huge. And so one of the things that I get really excited about it. So one of the things I just loved first and foremost was the fact that they were just very open to celebrate the extent to which, you know, the media coverage that had occurred at that time, pulling those archives. I got the opportunity to sit down with the archivist down there because he was just like, have you seen everything? And, just dig in and, be able to interact on a deeper level while I was down there was huge. And then, doing the media event, having the news channels there to really celebrate the monumental accomplishments that had happened from all the events and research treatment that occurred at Tuskegee, and one of the things, and I'm frustrated because I can't think of his name, but one of the patients that was treated there attended as well. And he was one of the first patients. And he was thrilled to see March of Dimes representation there. And he just kept coming up to myself, to our Alabama crew, of just thanking us for what we did. And, while we're so many years removed, so many decades removed, to know that our organization has been around for these 85 years, has been making such a major impact. It's heartwarming. It's why we are here to do what we do and to continue those efforts. So yeah, it was a great privilege to be able to speak on, some of our history that's attached to the place, seeing the monument, but then also, exactly what you're saying. Charles Bynum really broke the norm and created a new one. And he created it before a time where society really was ready for it. He brought it back to what I like to call the human factor. Like, as a country, as we're going through something that's so huge, so impactful in a negative manner, we came together as one to really support our whole community within the US. And I think that's really important for us to acknowledge.
So, once polio was wiped from the US, like we like to say, once polio was all but wiped from the US, because there's still like little pockets here and there that pop up. We moved on to birth defects. The next stage of our mission was birth defects, arthritis, and polio. Arthritis always gets me. I don't know how but it was explained as it's the crippling factor. So that was they kind of try to bring that into our mission. And then from there, the folic acid campaign and making sure that we could try to educate folks on having healthy pregnancies, their prematurity. Recently, more of a focus on maternity care deserts, health equity, implicit bias. So over those 85 years, we continued that first tradition of ensuring that we focused all of our work on everybody in the country and around the world. So what does health equity look like for March of Dimes today?
Yeah, I think that is an evolving term, right? And because one of the things is that it's not about just following a trend or a buzzword, which is why I think it's really important in the work that we are doing, because we really are trying to get to root causes. We're looking at how do we make true systemic change as well. And so when we look at especially our advocacy efforts, the huge wins we've had there, our mobile health efforts and more, we are constantly trying to drive change, breaking down barriers, getting in the communities that really need us, but then also understanding that health equity is not just about our organization, but it's about who can we partner with to even make an even greater impact. What can we do to bring resources? What can we do to bring education to the professionals? Because, one of the things, just highlighting like the implicit bias training, there's so many professionals that didn't even understand the history around many of the practices seen today and how they were built off of racism, and they were built off of brutal testing to our brown and Black populations. And so you have to think about, as we continue to evolve and we continue to look at what does health equity look like here, it's going to be really important for us to not just make it or have that perpetuation that it can be sometimes in society of like this buzzword, but it's an action. And so what are we doing to make that work? And so, shout outs to our collective impact work. Our MIH director is really getting in the markets as well with their common agendas and motivating and pushing that work of what's really needed on the ground. Highlighting our M-Band network. Our Mom and Baby Action Network is unbelievable. We had such a successful conference in October, just bringing, like I said, all those partners together, those community health workers, the funders, your federal organizations and more to the table to talk about, what can we do next? Because you can't just do one thing and expect it to work for years and years and years. And as you were just speaking to our journey, like needs change, society changes, and we are in a position where we are truly looking to adapt to make sure we're meeting that need. And so, with the onboarding of Dr. Chiro and being our new Chief Medical and Health Officer, I think it's going to be really interesting over the next coming months about, what does the future of health equity look like within March of Dimes and where we're trying to go.
This acknowledgement represents a bright and positive moment in history that has left an incredible mark on America and its people. It's also a wonderful reminder of the work we've done together to create a world where every mom and baby is healthy, regardless of their wealth, race, gender, or geography. A role that we're committed to continuing for generations to come. Thank you.
Thanks for watching today's episode of From the Archives, and a very special thank you to Rahni for joining me today. Want to learn a little bit more about March of Dimes history, or you have a question that you think might be answered in the archives? Leave a comment below in the chat and I'll get to it. So, until next time, thanks for watching.